is Nurse Sharina. Where are you at?
Hi, Dr. Z.
Hey, Nurse Sharina, how are you?
I'm good. How about you?
I'm doing well. I love the glasses.
Thank you.
So, Nurse Sharina, what of NCLEX High Yield did you use?
All of it. I originally sat for my first board in July.
Okay.
And so I had kind of heard about you, but I was like, I already got my own thing going right now. So let me just work that out. And then boom, went to 145 and did not pass.
Oh.
So I was like, okay, what do I have to lose, right? So I signed up for the August, September class.
The most recent one.
Mhm. So I was in that course, and then I took my second attempt on September 17th and was 78 and out.
Nice. So from 145 and fail to the most recent course that just ended, you were 78 and out.
Correct.
So you did the live course. You knew we were with you till you passed. You made the investment. Second attempt, I'm assuming?
Yes, second attempt.
Second attempt. So what was your thoughts about the course in general? And be honest, brutally honest. Like I'm like you can tell them I didn't like this, I didn't like this. You don't gotta tell them anything. You don't sugarcoat anything for me.
No, it was the best investment that I could have done. I mean, yes, it's expensive, but you also get what you pay for. Like the content was phenomenal. Just the tips that you gave me, the schedule, I followed it to a T. But like I took that to heart, and I studied for a month straight, including inside the course when we were doing our live discussions. So when I took my test, 70% of it was select all that apply.
Wow.
And I had 78 questions. So if I didn't know my content, I definitely would not be sitting here on the other side today.
Yeah. Well, I mean, I think 5 types of questions is so important because when we talk about select all that apply, it's really just signs and symptoms, risk factor. I mean, like you felt confident when you saw it, right?
Mhm.
And if 70% of it was your test, well, that just tells you that you shouldn't be intimidated by it. And you weren't.
Absolutely. And you gave me the confidence. I mean, before I was like definitely intimidated by those types of questions, but I noticed after really diving deep in the content and just all the things that you've taught us, I was getting questions right that only 20% of people were getting. That's,
Wow.
you know, so that definitely helped me break down
Yeah.
the tricks that the NCLEX does.
Yeah. So what is your advice for people on the other side?
Sign up for the course. Honestly, it's an investment. And I work in the ER, so I'm in the ED department. And just being able to, I took what you taught me to heart. And I took that content and I figured out the way I learn best. And for me, it was flashcards, like old school flashcards, right?
Yeah.
And when I tell you, I even got like tendonitis in my hand writing all the flashcards. But you could throw me something, and I can tell you signs and symptoms. I can tell you the treatment. I can tell you, just about the disease process. And then the ED, that's what helps me, being able to recognize what's going on because they're coming to me
And
first.
and that's real life.
Mhm.
Not just boards. 78 now is great on the boards, and now you're licensed. PN or RN? Oh, are you a PN or RN?
I'm RN.
RN. So licensed RN in the ER. So now you're going to see people first. Ask graph is a real thing.
Mhm.
It really is, right? Like everyone teaches ABCs, 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 but in real life, if you see ask graph, it's true, right? And
Absolutely.
when you recognize it, especially when you're the person's going to see the patient first. So that's amazing. That's amazing. So Nurse Sharina, any last words for your fellow students on the other side?
You got this. Just thank you, Dr. Z. Thank you, Megan, Crystal, the whole team. Like everybody's phenomenal. So I
Oh,
wouldn't be here without y'all.
thank you so much. And congrats, Ms. Rena.